My name is Laura Buehler, and I work in the podiatry department at Olmsted Medical Center. Well, in podiatry here, we do just about everything from treating fungal toenails and ingrown toenails to plantar fasciitis, making custom orthotics, treating bunions and hammer toes, and just basically any kind of fracture injury of the foot and ankle too. We just kind of cover it all. I became a podiatrist, which was just on accident, really. I had a really great undergraduate advisor that was my pre-medical advisor, and he told me just that I should go ahead and try to shadow every kind of doctor that I can and not just stick to the basics that everybody hears of, and just research all the different types of medical professions and choose from there. And so I shadowed so many different specialties, and it just turned out that podiatry was like a really great fit. And I always knew that I wanted to do surgery, and it made a nice like clinical surgical balance, and you treat diabetics and people that really need some help too. And probably the best thing about podiatry is that there's so many times when there's immediate treatments that we can give the day you come in the office that can make you feel better, and people can walk out of the clinical department feeling immediately better when they came in pain. And that's kind of just something that's really gratifying and sort of nice about podiatry in general. When patients come to see us in podiatry, it's very laid-back atmosphere, and we really do focus on trying to make sure we understand what your problem is and give you a variety of options to try to treat your problem, whether it be something simple like custom orthotics to take pressure off of areas, or if we have to develop some sort of surgical plan, we can do that as well. But it's always important to know that there's a process, and we're going to try to treat you as best as we can. And sometimes that's multiple appointments, or sometimes that's one immediate appointment that we can treat you right away. But we're really going to try to understand your problem and come up with the best solution together to try to treat everything that has to do with your foot and ankle. We do a couple of in-office surgeries that are fairly simple for hammer toes that have a very quick return to activity where you don't have to spend as much time off your feet. And we are also starting to provide minimally invasive surgery for bunions and hammer toes as well. And that's really important for bunion surgery because currently you typically have to take time off from work and be non-weight bearing, which is difficult. And that's typically like 6 weeks. But now that we're starting to do some minimally invasive surgery, that can get you back on your feet a lot sooner, and the recovery time is nearly cut in half. And so that's really helpful for people trying to get back to work or don't have a lot of time off of work to get their treatment done. So it's something that's coming that I think will be very helpful for the community. I think it's super important to make connections with patients because I want them to trust me and know that I'm their advocate and trying to do the best for them. And so really forming a relationship and trying to understand their problems and kind of their background and what they do for a living and what their home situation is like and things like that really help give us an idea of what the best treatment could be for them, if they have the ability to take time off of work, if they have the ability to be non-weight bearing or use crutches or things like that, or if that doesn't work for them, kind of what their expectations are so that I can form a treatment plan that works best for them. Probably my favorite thing to do outside of work, or especially in the summertime, because in Minnesota, we all love our summertime, is definitely camping. And so we try to take our 3 kids camping as much as we can, although that's absolute chaos, but we do it and we love it. And it's basically just spending time outdoors and being in nature and trying to just teach the kids to appreciate those little things. My favorite thing about coming to work, I really do love my job and feel like it really does serve the community. And being at Olmsted, I feel like there's a bigger connection with the community and treating the patients that are all around us that we all work with and interact with every day. And I really do think that Olmsted does a great job of providing for the community. And that's one of my favorite things, is just being able to give back and be able to treat people that have problems, and we can get them back on their feet and keep them going.